Hi everyone, my name is Laura Patrick. I'm joined by Dr. Andy Gilliland, sports medicine physician here at King's Daughters, and today we are touching on a very important topic, and we'll just go ahead and begin. The uncertainties of COVID over the last several months have caused a lot of questions, a lot of people to sit back and think, am I doing this right? What do I do? Where do I go? And that's especially true with our athletes. And at the forefront of what we do is athlete safety. And in the current climate, this has gained a lot of attention. So today we wanted to address some of the possible lingering questions that you may have as a parent, as an athlete, as a coach about COVID and athletics. So we'll just jump right in.
Sure.
So what is the current climate with COVID and athletics?
Sure. So in general, the current climate is that we're trending upward. And you may hear some epidemiologists describe it as an exponential climb. And it really needs to hit home that independent of sport, we have to do our best as a community right now to try to mitigate this as much as possible. You know, there's light at the end of the tunnel. We've got good treatments coming. We've got a vaccine coming sooner rather than later. But we still have a moment in time, a period of time, maybe the next 3 to 6 months, that we've got to keep mitigating. And it's hard, especially in our practice and in the world of sports, that we're trying to continue sports, which I personally think is a good thing, in the middle of this pandemic. And one of the new things that has started to crop up are the concerns about athletes and their return to sport and safety. And it's important for us to get this message out there beyond the mitigation strategies. What can an athlete do to return back to safety? Because there are different parameters based upon how an individual deals with the virus. So for example, a lot of times we hear this phrase asymptomatic carrier, and we think nothing of that. And for most of the summer and even into some of the fall, even asymptomatic carriers were requiring a very thorough workup to be able to return back to sport. So if you look at any of our university athletes at KCU, at Marshall, at Shawnee State, they were getting labs, EKGs, possibly echocardiograms. But fortunately, the algorithms changed in the past month to where people that get the virus, that test positive, that are asymptomatic, can work through a return to play progression, much like our concussion returns to play, and they can return without having to have any testing. The person that you should seek out for that would be your local athletic trainer. If you're in a middle schooler and you don't have an athletic trainer, talk to your coach or your athletic director. And if you're still confused about whether you're asymptomatic or you meet that criteria, call our office. The hard one comes when we have people that are symptomatic, but their symptoms are still very mild. So be it a mild fever, be it a runny nose, be it a mild cough, etc. We tend to think not much of these types of problems in a normal time. We think, oh, they had a little cold, they can go back to sport the next day. But with this virus specifically, there are some fears about the possibility of hearts and the possibility that the hearts could be affected. So the current recommendations for anybody that's, quote, mildly symptomatic is that they do receive some sort of a workup. And typically that workup is a set of laboratory testing that involves cardiac enzymes, inflammatory markers, and then probably an EKG or possibly an echo. The next step up in terms of type of individuals affected with this are the people that are moderately symptomatic, or the ones who truly get ill. So this is your shortness of breath, difficulty breathing, those types of things, and they definitely need a workup. You know, they're going to need the echo, they're going to need the labs, and what we're finding in our practice is a lot of parents are sitting out there directionless. And that's the purpose of this video today, is to try to give you guys some direction on what to do. So the first answer to the question, what do I do if I have a kid with COVID, is simple: talk to your primary care practitioner or physician. They should know the algorithms, and if they don't know the algorithms, we're getting this information out to them as well. If there's confusion or an inability to contact your primary care practitioner or physician, then you can certainly call our office. If you have an athletic trainer at your school, talk with them. So seek the expert care, because we don't want our young student athletes to be out there and have a symptom burden and then start to minimize their symptoms while they try to return, and then heaven forbid it turns out that they do have cardiac manifestations. Now, knock on wood, we've been pretty fortunate because we've not seen anybody with cardiac manifestations. And it may turn out that it's not as bad as we fear in terms of the risks for cardiac return to play. But in this moment in time, it's important that we're aware of the possibility, and it's important in this moment in time that we minimize the risk by doing the workup if they meet that criteria.
Excellent. And I think you've answered a lot of my questions. And I think, on the flip side, so, they've had COVID diagnosis. They need to seek the experts' opinions, talk to your PCP, talk to your pediatrician. Like he said, you can call our office if you have questions. But what if they haven't had COVID? So, in the 3 different states that we are in this area, we have different rules depending on where you are. So if you're practicing or playing an event or competition, somebody tests positive, but your child does not have COVID, but they've been exposed.
Sure. So that's a really good and important question. And it might actually be a more important question than the diagnosed individual, because doing this step you're asking about is really what's going to help us mitigate beyond masks and those things. So the question you're asking is, what's the premise of contact tracing? And it's really sport dependent, right? So if you look at sports right now, the way that we perceive them to be high or low risk sports. So for example, it's middle of winter now, or getting ready to be winter. Golf, I'm not going to play it, but golf is really low risk. So, if you look at athletes that return to play for golf with COVID or have been exposed to an athlete with COVID, they tend to play on. But you flip that and you look at athletes that do indoor sports, basketball, volleyball, etc., those risks may be perceived to be high. So what you need to do if you have been contacted or have been around an individual that has had COVID is you need to make sure that you have talked with your county health department. They're the individuals that are doing most of the contact tracing. That also falls to our university level. There are people with the counties that are doing the contact tracing, and they're going to be the ones that talk to you about quarantining and whether you need to. Now, some light at the end of the tunnel with respect to quarantining is that initially, if you were a primary contact, you would be out for 14 days. And it looks like the CDC is adopting a new principle, which is that if you are a primary contact, you only have to be quarantined for 7 days and then possibly test out at day 7. And that should make our burden of quarantining far less, because heaven knows the stress and the angst that we have when we basically have to shut our lives down. So in general, the general theme is this moment in time is not great. This moment in time, we're seeing this exponential rise, but over the horizon, we do see some light at the end of the tunnel. And if we can properly mitigate, make sure we have public awareness, not be apathetic to this epidemic, we may be able to get to that horizon and see the bright future that we have. So, by the time baseball season rolls around, we're back to normal. We're back to what we want to be as a people. And, it's been, I talked about it on an earlier video, it's like grieving, because we identify with sport and sport culture so much in the tri-state, and we just lost it. And it really does hurt. And I can sense the mental health issues that are coming on with our young athletes. I can sense the angst in the parents. So that's why I thought this video was important to do.
Excellent. And it's really good information, and I think that our parents and athletes will find this very helpful. So it's important to wear your mask, wash your hands, social distance, of course, the message that's being put out all across the community. But it's also nice to know that there are drive-through testing centers. You do need an appointment, but the number will pop up on the screen here for you in case you need to drive through and get tested. You can stay in your car. There's also blood work locations. So we're trying to make that as safe and efficient as possible.
Yeah, our local hospitals, you compare the resources that we have, fortunately, in our region right now to the rest of the nation, and we've been very fortunate, because you don't have to wait the 72 hours to 56 hours for a result. These lab techs and the people running the lab downstairs are just busting their butts, so they deserve to be applauded. And we should have Think a Lab Tech Week, because they're doing incredible. They really are.
They are. Well, thank you so much for your time. This education is extremely important. We love our athletes. We miss them, but we want them to stay safe as possible. Hopefully this information was helpful, and please reach out if you have any questions.
Call with questions. It's that simple.
Thank you.